Let's now take a look at the last group of muscles you're responsible for learning for your practical, and those are the muscles of the lower extremity. The first muscle is the gluteus maximus muscle. This is the large muscle that makes up the superficial muscle, makes up the bulk of the shape of the buttock region. So here we see a posterior view of the cadaver. We'll go ahead and highlight the gluteus maximus muscle. So again, here it's highlighted in purple. We go ahead and remove the highlighting. You can see the muscle fibers and their direction. Gluteus medius is going to be lie underneath and a little bit more lateral to the gluteus maximus muscle. So let's go ahead and highlight the gluteus medius muscle. So the gluteus maximus has been removed, and you can see the purple coloring here for the gluteus medius muscle. We'll remove that highlighting so you can appreciate that muscle in its entirety. So again, gluteus medius, a little more lateral. It's deeper than the gluteus maximus. Just for perspective, we'll go ahead and show the gluteus maximus again, and then the gluteus medius. The next muscle to identify is the semitendinosus muscle. The semitendinosus muscle is one of the muscles of the hamstring group. So there are three muscles that make up the hamstring group, or the muscles of the posterior thigh. That would be the semitendinosus muscle, the semimembranosus muscle, and a muscle called the biceps femoris. Those are the next three muscles in your word list. Let's identify the semitendinosus muscle first. So again, we've got a posterior view of the thigh. Highlighted in purple, we see the semitendinosus muscle. We'll go ahead and remove that highlight, and we can see this muscle here. The semitendinosus muscle has a very long tendon that we can appreciate with the highlight color. So this big long tendon here that allows that muscle to form an attachment point down on the tibia. That muscle is the semitendinosus muscle. It is a muscle on the medial side of the posterior thigh. The next muscle is the semimembranosus muscle. Again, also a medial posterior thigh muscle. It's got more of a broad appearance to it. I'll go ahead and remove the highlight so we can see the broad semimembranosus muscle. The semimembranosus muscle lies deep to the semitendinosus muscle. So again, for perspective, let's put the semitendinosus muscle back on. So we see that muscle here. If we were to remove that semitendinosus muscle, which we see here, we will look a little deeper, we will see the semimembranosus muscle lying underneath. The next muscle to identify is the biceps femoris muscle. This is the third and final muscle of the hamstring group. This muscle is going to lie on the lateral side of the posterior femoral compartment. So let's go ahead and identify the biceps femoris muscle. Here we see it highlighted in purple. Again, we'll remove the highlight, and we can see biceps femoris here. We had our semitendinosus and semimembranosus muscles on the medial portion. The next muscle to identify is a muscle called the tensor fascia latae. This muscle is on the anterior. We need to look at an anterior view of the hip. And the tensor fascia latae is a very lateral lying hip muscle. And we can see that lateral lying hip muscle right here. That muscle, the tensor fascia latae, is actually connected to a very long tendinous band that connects down to the lateral aspect of the knee. This long band here is known as the iliotibial band, sometimes known as the iliotibial tract. That is the last structure on your word list, and I will show you that when we get to that structure. The next muscle to identify is a muscle called the Sartorius. So we'll go ahead and highlight the Sartorius, a very long, thin muscle, a very strap-like muscle that is unique in that it moves obliquely across the thigh from a lateral direction to a medial direction, attaching to the medial aspect of the knee. So this is Sartorius. Again, we'll remove the highlight so that we can see the muscle fibers. The next muscle to identify is the gracilis. The gracilis is going to be a medial thigh muscle. It's going to run the length from the pubic bone all the way down to the medial knee. So let's go ahead and identify the gracilis. We can see the gracilis here. Very long strap-like muscle, very similar to the Sartorius, although again remember that the Sartorius moves from a lateral to a medial direction across the thigh. The gracilis stays medial the whole way from its origin to its insertion. The next four muscles, the rectus femoris, the vastus lateralis, vastus medialis, and the vastus intermedialis, these muscles make up the quadriceps group. So they are anterior thigh compartment muscles, and they're known as the quadriceps group. Let's take a look at the first one, which is our rectus femoris. So the rectus femoris lies right in the middle of the thigh. It's the most anterior of these muscles, and it is also superficial. So we'll remove the highlight color here so we can appreciate the rectus femoris. The next muscle is the vastus lateralis. The vastus lateralis is a muscle that lies on the kind of lateral anterior compartment of the thigh, also a superficial muscle. We see vastus lateralis here in purple. We'll remove the highlight so that we can appreciate vastus lateralis in its entirety. Vastus medialis is going to be in the medial compartment of the anterior thigh. So let's go ahead and identify vastus medialis again, highlighted here in purple. We'll remove the purple coloring so we can see that muscle in its entirety. The vastus lateralis and medialis, you can appreciate that they lie both lateral to and medial to the rectus femoris, which lies right in between the two. The final muscle to identify that's part of the quadriceps group is the vastus intermedialis, or the vastus intermedius. And we can see this muscle here. This muscle lies just deep to the rectus femoris. Again, we'll remove the highlighting so that you can see the vastus intermedialis. This muscle is deep to the rectus femoris. I will highlight the rectus femoris again so you can appreciate how this muscle is deep to the rectus femoris. Here is rectus femoris in purple. Again, if we remove the rectus femoris, underneath we can see the vastus intermedialis lying just deep to that. The next muscle or group of muscles are known as the adductor muscles. These muscles are actually a group of separate muscles. We don't need you to remember or to know all of the names of this group of muscles, but we can see them here. I'll go ahead and highlight a few of them. So we have the adductor muscle here. This is called adductor brevis. This muscle is called adductor longus, and then the large adductor muscle here known as adductor magnus. You would just be responsible for knowing this group as a group of medial upper thigh compartment muscles known as the adductors. The next set of muscles and structures that we're going to identify are going to be in the lower leg. I'll go ahead and show you the iliotibial tract or the iliotibial band so we can see it highlighted in purple. This is that long connective tissue band that connects the tensor fascia latae, that lateral hip muscle, down to the lower part of the knee. So again, I'll remove the highlighting so we can see this connective tissue band. If we go ahead and rotate, take a look at the tensor fascia latae muscle, which we see here, and this connective tissue structure that connects the tensor fascia latae all the way down to the lateral knee is our iliotibial band or iliotibial tract. Let's go ahead and move to the lower leg and the foot. First muscle to identify is our tibialis anterior muscle. So we've got a an anterior view of the lower leg. Tibialis anterior muscle we see here. This is our tibia, just lateral off the anterior border of the tibia. We see the tibialis anterior. It's got a long tendon that moves across the ankle and attaches to the medial portion of the foot. So again, if we remove the highlighting, we see this as being the tibialis anterior muscle. The next muscle to identify is the gastrocnemius muscle. To see that, we're going to have a posterior view of the lower limb. Gastrocnemius muscle is one of the muscles of the calf. So this superficial muscle here being the gastrocnemius muscle, we can remove the highlight and we can see the muscle bellies of the gastrocnemius. Lying underneath the gastrocnemius is the other calf muscle known as the soleus. So we remove the gastrocnemius, we see the soleus highlighted here in purple. Let's remove that purple highlighting so we can appreciate the deep soleus muscle. So this muscle is the soleus. Again, I'll show you the gastrocnemius, which lies just superficial to that soleus. We'll remove the highlighting. We can see the gastrocnemius here. These two muscles have a common tendon that allows them to insert onto the calcaneus, which is one of the tarsal bones, the heel bone. And this common tendinous insertion is known as the Achilles tendon or the calcaneal tendon. Go ahead and highlight that tendon here. So this tendon in purple, we'll remove the highlighting. This tendon here is a common tendon that receives both the gastrocnemius and the soleus muscle. Those muscles merge to form this common tendon and allow that tendon to insert onto the calcaneus bone of the foot. Final muscle to identify is a muscle called the peroneus or the fibularis muscle. This muscle is going to be found on the lateral aspect of the lower leg. To see this, we're going to go ahead and take that anterior view again, and we see this long lateral lower leg muscle known as the fibularis. It courses along the length of the fibula and attaches down at the lateral part of just past the ankle joint. We'll go ahead and remove the highlighting so we can see that here. So this would be the fibularis muscle. Just medial to that, we'd see our tibialis anterior muscle.